The disease name is age-related macular degeneration. Being age an independent risk factor and the first factor for the disease to happen to make its appearance in anybody. So getting old is the first risk factor for the disease. Normally starts around 60 years old, but if you were to live enough, everybody will develop the condition. The second risk factor for the disease is smoking, cigarette smoke. And then there are other contributors in which that could play a very important a role in the disease, which is the genetic component. But the problem with the genetic component is that it doesn't explain more than 50% of the disease. So it is there. Your genes do predispose you to develop the disease, but it's not what drives the disease. It's the fact that we are getting old, and as we get old, we lack the ability to clean and to preserve the tissue, and those cells that are being affected are cells that you're born with them and they are not replaced. So once you're not able to take care of those cells, the disease affects them and kills them. Age-related macular degeneration, when it starts, is asymptomatic. Once the disease starts to progress, the person can start saying that they have decreased vision, metamorphopsia, which means the lines don't seem straight and stuff starts to become a little bit distorted. And as the disease progresses, depending on the severity of the dry or the wet form of the disease, you can get actually scotomas, which is lack of the ability to see clearly in the center of your vision. It never really blinds you like glaucoma that takes away all your vision. It takes away your central vision as opposed to your peripheral vision. When you're in the early, which is most people, they don't require any type of treatments. Living a healthy life, eating healthy, green leafy vegetables, not smoking cigarettes, stuff like that. Once the disease becomes more like an intermediate type of disease with high risk characteristic, then the number one treatment that we have and has been FDA approved is the AREDS2 vitamins. And it's just not vitamins, also minerals, and it's a formulation that was studied in a multi-center trial that is called AREDS. When you get that wet form, we have other medications that are normally delivered by injections inside the eye. They are called anti-VEGF medications, and so far we have multiple ones that have been FDA approved, like Lucentis and Eylea. Once you get it, it's going to progress at different rates, but it will progress. Once you have the dry form, it will take many years for it to develop into the late forms of the dry forms, or it can also progress to the wet form. And once you have the wet form, you will always have the disease, meaning that those treatments that we have are not curative. They are treatments. As long as you take your medications, it's going to be most likely than not controlled. You will have to be followed by somebody like a retina specialist to make sure that you're receiving the treatment in the schemes that there are right now instructed to be able to control the disease.